Hello everybody, I'm back here in the WNEP Digital Studio with another update on the COVID-19 vaccine situation and an update on COVID-19 itself and the spread of the virus here in Pennsylvania. And of course there are frustrations when it comes to people getting the COVID-19 vaccine. But as we break down the numbers here, you'll see that there are a lot more people that are getting vaccinated. And more importantly, as we track the virus itself, those numbers keep going down and down. The spread of COVID is definitely slowing here in Pennsylvania. So let's take a look at the situation that we have here in the state. I say every time that I do these, I find it helpful to see all these numbers instead of just having some big numbers thrown at me, and I hope you do too. So let's take a look. Here are the latest COVID-19 vaccination numbers in Pennsylvania right now. This is just in from the Department of Health. Total shots given here in Pennsylvania since December is 2.2 million shots, 2,226,004 shots. So that's the total number of shots that have gone in. The total number of people is 1.5 million, 1,576,984 people have had the first dose. And of those people, 649,000 have had the second dose and are fully vaccinated. So when we look at that, I understand some people when they watch the Facebook Live, it's tough to see this bottom number. Again, that's 649,000 have had the second dose and are fully vaccinated. This breaks down to about 11% of Pennsylvanians have had the first dose, and around 5% of Pennsylvanians have had that second dose and are fully vaccinated. So how does it break down here in our viewing area? Well, what we are seeing is that the counties you see in the yellowish green here, they're the ones with 14% and up of their population that has had at least that first shot. So that is Center, Union, Northumberland, Montour, Columbia, Sullivan, Luzerne, and Lackawanna. The counties you see in blue, which is most of the rest of our viewing area, they're between 9 and 13% of the population that's had that first shot. The Poconos are lagging behind. You see Monroe and Pike County 8% and less. One explanation we got for this, and we actually have a whole story on this tonight on Newswatch 16, is that the Poconos are much younger than the rest of our viewing area. This is a lot of people who have moved here from New York State, New York City, New Jersey, a much younger population. The rest of our viewing area tends to be quite a bit older. That's the explanation we're getting from healthcare workers in the Poconos about why they're lagging quite a bit behind what we're seeing in the other counties here in our viewing area. Because when we look at that, here's a breakdown of the 6 most populated counties in northeastern and central Pennsylvania. Luzerne County's had 53,000 people get at least the first dose of the vaccine. That's 17% of Luzerne County's population. Lackawanna, it's 41,000, 19% of the population. Schuylkill's seen 19,000 people get a vaccine so far. That's 13%. Northumberland, 15,000, 17% of the population there. Lycoming County has 15,000 people have had a shot, at least one shot so far, 13% of the population. Here's Monroe, 13,000, 8% of the population. Monroe is third when it comes to the size of the counties in our area, but sixth when it comes to the percent of the population that has been vaccinated. I want to go back real quick to show you this. When we talk about these numbers with the vaccinations that were given, we talked last week about how the winter weather across the whole country was slowing shipments of the vaccine. In fact, last Monday, Tuesday, Wednesday, Thursday, Pennsylvania didn't get Moderna vaccines because of those delays in shipments. And then also we know there was the mistake last week that we learned about last week that at least 100,000 people had their appointments delayed because the state had some kind of a mistake in that some providers were giving doses meant for a second shot for the first one instead. And so they had to kind of scramble to make sure that everyone got that second dose on time because all of a sudden there was this missing amount that was allocated for the second dose. So that's kind of an explanation. We were off the first few days of this week about 50-some thousand vaccines from the same time last week. So there was definitely a slowing down to start the week, but I will say it has picked up as this week has gone on, and Pennsylvania has actually been allocated more vaccines now. So we should, as we go ahead, see more and more people vaccinated and this number go up. But as we keep getting told, This is the amount of shots that's been given, and these are the amount of people. So 1.5 million people have had the vaccine so far. There's nearly 4 million eligible right now in Pennsylvania in this phase 1A. So there's a lot more people in this phase to go to get the vaccine. Again, this phase is older Pennsylvanians and people with high risks along with healthcare workers. So let's move along now and go to this. When we're talking about older Pennsylvanians, this is the breakdown now of the percent by age of who's been vaccinated with at least one shot. 25% here, that's 75 and up. The gray here is ages 60 to 74. So if you split this in half, more than half of the vaccinations have now gone to people who are older than 60. And when vaccines were starting here in Pennsylvania, it was the opposite. The older people were getting them the least. Then the state changed course, started vaccinating the elderly, and we've seen a big change with that. Most of the vaccinations happening across Pennsylvania right now are targeted at those that are older. And we know and we hear from a lot of you that are really struggling trying to get an appointment. And there is a lot of frustration that's out there. I got an email today from someone that was on the phone for 8 hours. They were on hold, determined to get through to someone, only to be told they had to be put on a waiting list. Those are the kind of stories we're hearing, the frustrations from people trying to get an appointment. And I'm sure there are some of you watching this right now. And if there are, let us know your story. You can type it there in the comments. Just curious to see what people are dealing with trying to get that vaccine. And if you had the vaccine, and if you've had the second dose, also you can use the comments there to let us know what your experience was like, because I'd love to know how it went, how hard it was to get the vaccine, and then also if you could comment about any reactions that you've had, because we've heard from especially younger people after that second shot that get the chills, aches. Some of them have been pretty sick, usually only lasting about 24 hours, but we'd love to hear from more of you about your experience getting the vaccine. Now I want to move on to COVID-19 itself. I kind of want to distinguish between, we have all the vaccine numbers, and now we're going to get to all the COVID numbers. These numbers on COVID itself keep getting better and better. I don't think when we were back in January, we thought we'd see improvements as quickly as we have, but we have. Here's the week-to-week trends here in Pennsylvania, comparing last week with this past week. And new cases, we saw 200 or 2,000 fewer cases this week added than we did the week before. The incidence rate, which is the number of people per 100,000 who test positive, that's down from 118 to 101. It hasn't been down to 101 since back in October. Positivity rate down from 6.5% to 6.3%. This is one of the vital stats that the health experts track to understand how much community spread there is. That's the percent of people going and getting a test who have a positive result. Again, that's down to 6.3%. We keep hearing about the 5% threshold is what's concerning, and we keep getting closer to that 5% number. And hospitalizations, 308 fewer patients in hospitals this week than what we saw last week across Pennsylvania. And that plays out with what we see. This is the graph tracking the new cases across the state since testing began way back in March. And we saw the summer and our big spike before Christmas, a dip right after Christmas, a spike right after New Year's, and it has been declining since early January. We started, you see that's January 7th, right around January 7th we hit that second peak, and it's been downhill since then. So big improvements that we've seen in Pennsylvania in that downward trend of new cases. And I keep watching, every day I type in the numbers with the latest numbers, and then this will compute and tell me, where the trends are going, because each dot is tracking the average of the last 14 days. And I keep waiting to see when we kind of level off a little bit. We haven't. This keeps going down, which is what we, of course, all want to keep seeing. Here's the numbers today across northeastern and central Pennsylvania. These have become noteworthy because we've had a lot of single-digit days in the teens. When we look at this map compared to just a month ago, it's a big difference because it's much lower. Union County had 128 new cases today. I asked the Department of Health for a little explanation for that because that's way more than what Union County has been getting recently. Luzerne at 67, that's a lot less than what Luzerne was seeing a little bit ago. Same with Lackawanna, 57, Lycoming 36. Lehigh Valley it's the bottom of the map. We show it on the map because a lot of people travel to and from the Allentown area. We are on TV down there and some people have an interest. They've been above our viewing area for a few weeks now. And you see again, they're in the hundreds down there. Here's what we've been talking about with the hospitalizations. And of course, we've been told for a year now, since the beginning of this, that the big issue that the health experts and the governor and all those people have been concerned about is making sure hospitals don't get overwhelmed. And obviously, if you're concerned about that, this is a really promising sign when you see how much, when you see how much the hospitalizations have been declining since mid-December. Mid-December, we saw, if you look, there's the numbers over there, we saw around 6,300 patients in hospitals across Pennsylvania on one day. That's back when you were hearing from friends that were nurses and doctors at hospitals just how hectic it was for them then. Now we are down to below 2,000. So you think of that, we're more than 4,000 fewer patients than we saw back then. So a much improved situation in the hospitals across the state. And the reason that we keep a close eye on the hospitalizations also is that is telling us, of course, how sick people are getting if they have to be in the hospital. And I want to just real quick, I know I say this every time I do a live here in the digital studio and break down this, but please remember, if you're watching this, that almost everybody that gets coronavirus is able to treat it at home. It's about 2-3%, even back at the peak, that have had to go to the hospital. So it's a very small percent that gets sick enough that they have to go to the hospital. I'm not saying people aren't getting sick at home and feeling really bad, but they're not sick enough to have to need hospitalization. So that's an important distinguishing factor of this. COVID hospitalizations here in northeastern and central Pennsylvania. These are the hospitals, or the counties, with the most people in the hospital right now with COVID. Luzerne at 45, and when you see over here down or up, that's this week, the difference this week. Luzerne County was up near 200 hospitalizations a month ago. Montour was too, that's where Geisinger Medical Center is in Danville. 35 patients there, Lackawanna 32, Monroe 26, Bradford 26, Schuylkill 24. I mean, you see these numbers, that is not a lot of people in our whole viewing area hospitalized because of coronavirus. So this is a big deal that we are seeing those numbers go down so much and see so many fewer people in the hospitals, because of course that's we don't want to see our neighbors having to go to the hospital. So big improvements when it comes to people having to go to the hospital. Another big improvement, and I keep saying this is the most important improvement, is when it comes to COVID-19 deaths. There was our spike back in the spring. The summer was rather calm. The big spike we saw around the holidays, and it has been declining ever since. It's a little deceiving because it goes down so far here. Remember, when they report the death numbers, they can go back several days. So these days tend to rise, but we are in about this level of adding a little over 50 deaths a day. Obviously, we don't want to see any, but 50 beats almost 250 a day, which is what we were seeing back in December. Again, this graph is tracking the date that the person died, not the date the state reported it. So the peak was right around Christmas there. And again, when you look at deaths, it is people who died with COVID. So there's obviously people that have a lot of other medical conditions too. COVID might be the spark that put them in the hospital and sadly ended their life. But it just is the people that died of COVID and with COVID here in Pennsylvania. So when we look at this this now is going back to kind of that positivity rate. Remember I said Pennsylvania was down to 6.3% now, getting close to that 5% range. Well, here's the counties with the highest positivity rate in our viewing area right now. And those are going down to, we saw a little up to Clinton County, a little higher with 11.5%. Sometimes in these smaller counties, it can mean that there's just not as much testing being done as there is in some of the bigger counties, but Clinton 11.5, Pike 10.4, Monroe 9.7, Wyoming 8.9. You see the Schuylkill, Columbia like coming around 7%, Luzerne, Wayne, Carbon around 6%, Lackawanna is down near 6%. We have several counties below that concerning level of 5%. There were a bunch of counties in the 20% plus range when it came to positivity rate just about a month ago. So this again is another big improvement. This is what's tracked to see again how much community spread is really out there, and we are seeing that much less now than what we saw 2 months ago. These numbers are still saying it's out there, and we all know the virus is still out there based on the numbers we're seeing every day, but it's not out there as significantly as what we saw before. We're just going to look at some of the counties that are around here now just to give you a perspective of some of our bigger counties, our hardest hit counties, and how they've been trending. They're all trending kind of the same. Luzerne County, this was the fall when it saw the rise from October to mid-December, a little dip right after Christmas, another spike for New Year's, and it's been downhill ever since then. So trending downward for Luzerne. In perspective, Luzerne County was adding around 300 new cases a day back in December. It's now adding, I think the last I saw is averaging around 60 to 70 new cases a day. So a third of what Luzerne County was adding just a couple months ago. Lackawanna, same way. A rise all through the fall, up near around 150 cases a day back in mid-December. It is now ticked down to averaging around 50 new cases a day, so a third of what Lackawanna County saw when it was at its peak. Lackawanna leveled off a little bit the past few weeks, but it's turned down again and starting to trend back down again, so it was good to see that. We just saw Luzerne. I'm going the wrong direction. This board is touchy, as you can see. Schuylkill was low all year, then started rising all fall long, got up to right after the holidays, a spike of around 150 cases a day, and it's just been downhill since then as Schuylkill County trends downward. Schuylkill's now, it was adding 150 cases a day. The past week or so, I've seen a bunch of 12s, 15s, 16s, big change in Schuylkill County. Now we're looking at Monroe County, the Poconos. It was the first one to see a spike back in the spring when all that interaction with New York City was happening. Then it rose this fall, a spike right after Thanksgiving, a spike right after Christmas, downhill since then. It started to level off a little bit, but again, it's starting to tick down a little bit too. It was averaging 100 cases a day. Now it's averaging around 40 cases a day, so less than half of what it was seeing at its peak. Lycoming County peaked at near 150 cases a day, and then it has been in decline ever since. It was leveling off a little bit, but again, it's turned down, and it's now averaging around 35 new cases a day after being up near 150. So you can see a big difference in Lycoming County compared to what was in mid-December. Northumberland County leveled off for a while there in December and has been going down and then took another little dip. We're seeing quite a few low single-digit cases in Northumberland County just the past few days. So good to see that for Northumberland. I saw Lycoming already. Columbia County, another one. Bloomsburg University, these are some of those spikes from Bloomsburg University's big cases, but it has been on a downward slope since, same thing, since January. Bradford County, similar story. Long rise of new cases, stayed at a relatively high level for a smaller county, averaging around 40-some cases a day, and now it's down, averaging around 15 cases a day. So a big difference there. So that brings us back to the first screen, brings us back to the vaccine numbers. Now, when you ask health experts about what's going on with why are these numbers going down so fast, obviously a big explanation is so many people are getting vaccinated, even though there's so many more people that want to get vaccinated. And there aren't a lot of other answers right now as to exactly why the numbers are going down so quickly, because I'm just going to go ahead real quick to this. The national graph of new cases is almost steeper than this. The national graph, we peaked again around the holidays, and it is a steep drop off. Cases are down more than 70% in the US since the holidays. So a big difference that we're seeing there. Hospitalizations, same thing, big decline nationwide. COVID-19 deaths nationwide, another big decline. So I appreciate you tuning in for this. I hope you find this helpful. I do this every day. I go through and I type in all the data. I've learned to use Excel more than I ever did before. I'm a little self-taught on that, and then I got some help making all these graphs and everything, so now I make these every day, and I figure as long as I make all this, I might as well give it all to you, because we don't quite have time on the news to go through all this and break it down for you. But we hope to see these promising signs continue. I know when you watch the national news, you keep hearing about variants and things like that, and of course those are things to be concerned about, but we've been told many times throughout all this about something that is coming and then it doesn't. So what I'm focusing on is the situation that we know is happening based on the numbers that we're getting, and just report that. and we'll see what happens and just have to hope that things don't get worse and they just keep getting better. So thanks for tuning in. We'll be on the news tonight at 5:30, and next week sometime, hope to do one of these again. See you later. Have a great weekend, everybody. Bye now.